Dr. Himanshu Gaikwad is the next speaker. Your presentation. Himanshu Gaikwad. Oh, sorry. Isha is there? Or yeah, sorry, I skipped one by mistake. Dr. Isha. See, I had a sixth sense. Dr. Himanshu Gaikwad.
Good morning. Today I am going to present on use of sodium tetradecyl sulfate for managing patient with orbitopalpebral cyst as an alternative therapy for surgical intervention. So coming to the introduction, orbitopalpebral cyst results from non-closure of embryonic cleft at 5th to 6th week of intrauterine life. There are two varieties. First is microphthalmia with cyst, second is orbitopalpebral cyst. So orbitopalpebral cysts have a tendency to grow and consequently requires treatment. So there are two treatment options. First is sclerosing agent after paracentesis, or either we can go for cyst excision. So in our study, we use sodium tetradecyl sulfate, which is commonly used sclerosing agent for varicose veins and venolymphatic malformations. So aim is to evaluate the efficacy of sodium tetradecyl sulfate as a sclerosing agent in patient with orbitopalpebral cyst and microphthalmia with cyst as an alternative for surgical intervention. So coming to material methods, it is a retrospective interventional case series of 7 cases of orbitopalpebral cyst with patient of more than 10 years of age who were treated with cyst fluid aspiration followed by injection of STDS injection into the cyst. Outcome measure was resolution of the cyst, that is more than 70% of the reduction. And after resolution, socket reconstruction procedures was done such as enucleation, DFG, fornix forming sutures, canthotomy, canthoplasty, etc. Followed by fitting of customized ocular prosthesis. So coming to the results, there was 7 number of patients. Age group was 18 to 26 years. In 4 of the cases, they only required one injection. In another 2 cases, which required repeated injections, and in one case, there was non-resolution even after multiple injections. So mean duration for complete resolution in our study we have found of 2.5 months. None of these patients showed any evidence of local or systemic side effects. So this is the one of the patient. We can see this is the pre-injection, and post-injection there is a cyst resolution which can be seen, and afterwards COP was fitted. This is another patient with pre-injection and post-injection resolution of the cyst. This is one another injection which pre-injection images, then post resolution of the cyst, and in third image we can see the COP. So coming to the discussion, sodium tetradecyl sulfate is synthetic anionic surfactant acting as sclerosing agent that is available as 1% and 3% of the aqueous solutions. Sclerosant already which are being used for varicose veins, gastric varices, renal cyst, lymphangiomas, thyroid cyst, and hepatic cyst. So in our study, we have used 3% sodium tetradecyl sulfate. Ethylenamine oleate and sodium tetradecyl sulfate, these are the sclerosing agent which are commonly used for treatment of orbitopalpebral cyst. So Nayak et al. In 1997 stated 86% cyst resolution with ethylenamine oleate. In a study with Belkinsinkop et al., STDS was considered more safer than ethylenamine oleate. So, in Chabra et al., they reported that complete regression of orbitopalpebral cyst with use of STDS in a case series of 8 patients. So known side effect of sodium tetradecyl sulfate is pain, urticaria, asthma, anaphylaxis, but these all are being reported with intravenous use only. So ethylenamine oleate has been reported side effects such as pleural effusion, pulmonary thrombosis, arrhythmia, right cardiac failure with intravenous use. So no serious complication were noted with use of both these drugs. So to conclude, injection of STDS as a sclerosant is very easy and effective and can be used for resolution of orbitopalpebral cyst with no to minimal side effects. Thank you.
What was the dose of sodium tetradecyl in your study?
Ma'am,
And which
according,
technique did you use for administering this particular agent?
ma'am, we have used,
That you didn't mention in your study.
Dilution.
yes,
Did you dilute it?
Yes, no, we have directly taken the STDs,
Oh.
formed the froth of the froth, then we have injected directly into the cyst.
And how much you injected?
Ma'am, it is based upon the aspiration of the fluid, how much fluid we aspirated. Upon that, we calculate the dose of STDs to be injected.
What percentage?
3% STD.
Usually when we aspirate, 10% of the volume of the aspirate,
Yes, yes.
20%. So what is your?
Sir, 20%.
The same concentration which ampoules coming.
Yes, sir.
Same?
Same concentration. The 3% sodium tetradecyl sulphate.
Oh.
The same concentration we have used. We have formed froth, and we have injected.
Because when we usually inject for capillary hemangioma, then we dilute it. Otherwise, it will cause necrosis.
So we haven't noticed any necrosis also.
Sometimes it causes necrosis if you inject little more higher concentration. Because inside the orbit you will not know that what happened actually. So I think it should be cross-checked.
Right.